The transgender community. Ever since the HIV/AIDS epidemic in the 1980s, the incidence of infection has been reduced thanks to the LGBTQ community and public health organizations' education to the public. But in more recent years, we're seeing a rise in HIV infections in one population, men who have sex with men, including transgender females. It's estimated that 2% of the U.S. population are gay men, men who have sex with men, and transgender females, while 56% of all people who are HIV positive are in that 2%, along with 2/3 of new infections. Studies have found that more than 1 in 4, or 28%, of people are HIV positive, and a majority are unaware that they are infected. Transgender people are at a greater risk for contracting HIV because it's proven that alcohol and drug use are more common in their community, and it is known that drug use is associated with the transmission of infections, whether it's from a dirty needle or unsafe sex. If it's not drug use that's the problem, it's the decreased access to antiretroviral therapy used due to poor access of health care. How can we reduce these numbers? PrEP is a drug that is proven to reduce the incidence of contracting HIV. It's recommended for people who are at risk for contraction, including transgender females. The CDC recommends yearly testing for men who have sex with men and more frequently for those who are at a higher risk. But testing isn't enough. You need to follow up with medical care if you're HIV positive. But members of the LGBTQ community experience more challenges and barriers to accessing quality health care than the average person. Some of these barriers include inequality in the workplace and health insurance sectors, meaning denying a person of the health care access they need, the provision of substandard care, which is due to a lack of understanding on the provider's end and outright denial of care because of an individual's sexual orientation or gender identity. LGBT people tend to experience gaps in health insurance coverage, cost-related hurdles due to a lower income, and poor treatment from healthcare providers. Some recommendations to improve healthcare could be an inclusive environment through including various gender identities and sexual orientations on health history forms. This can also be achieved by simply putting LGBTQ pamphlets out for anyone to read. Non-discrimination policies can also aid in a more comfortable environment, especially if they're displayed. Staff should be trained in how to communicate with LGBT patients, such as the right pronouns to use and the right questions to ask. All of these improvements can lead to trust between the provider and the patient. These improvements will not only impact the care that HIV-positive trans females receive, but any health care for any LGBTQ patient.